So we are going to shift gears a little and move on to our Opportunity Lives segment.
Well, with us today is Amelia Hamilton. She's a contributor for Opportunity Lives. So, Amelia, thank you for joining us.
Hi, good morning.
So, Amelia, you recently wrote a story about correlation between the opioid epidemic and the rise in foster children. And your article was actually shared by Chelsea Clinton on Twitter, which is amazing. Why don't you tell us a little bit more about your piece?
Yeah, I was writing about, as we all know, the opioid crisis right now is, a huge issue in America. And children are often sort of the unseen victims of this. And as more and more children are being taken into foster care away from parents who are unable to care for them, the foster care system is unable to keep up with this demand. So there's a growing need for foster parents, and there are so many grandparents who are now raising a second or even third generation of children. They've raised their children, grandparents, even in some cases great-grandchildren. So I wrote this piece about children needing to be taken care of in this issue and being sort of unseen. And it was great to see Chelsea Clinton share the piece. It's great when we see that solutions are something that are nonpartisan, and we all need to just work together to address the issues and look beyond, this is my party or your party or how we all see things. And just, we know there's a crisis. We know there are children who need to be taken care of. What can we do next? So to see someone with a large platform, of course, it's a bipartisan. There was a hearing from the Committee on Aging last week discussing this, and that was a bipartisan hearing as well. And it's great to see people working together just purely to look at a solution.
And I mean, talk about what you see as the most effective solutions thus far.
Well, a lot of what they talked about were community-based solutions. There are some, they also discuss, some government solutions in terms of things like healthcare. But, a lot of it was people feeling isolated, people needing, connections within their community. The other people that they know with babies are the age of their children. They're not in their 70s. They're people that they know in their 30s, or the people that they've always been friends with are traveling all the time and they're retired, but they're not able to retire because now they have a newborn, and they're in a completely different phase of life, and they're feeling completely isolated. So there was a lot of talk about community-based solutions to connect people with each other, to overcome that feeling, to look for solutions, even just in terms of material things. You get a phone call in the middle of the night that your grandkids don't have anywhere to go, but you live in a one-bedroom apartment and don't have a crib. So there are places to call to help you get that, or the clothing that you need, help navigating public schools, or all of the legal issues involved with getting custody and everything that you need in order to take care of a child. So it was great to see the marriage of private and public solutions that all come together just to work for these children.
Amelia, can you talk a little bit about stigma? Because I do a lot of work in the mental health community, specifically with men and women who struggle with eating disorders, body image, and co-occurring disorders like obsessive compulsive disorder, depression, anxiety, and other addiction. So I battle with the stigma that most people who haven't had any exposure to these issues, it's still out there, and it makes it really, really difficult for people to seek the help that they need, for people to get into these communities that you're talking about. Do you feel, as someone who's interested in covering this and been doing a lot of legwork, do you feel like this tide of stigma is starting to turn? Because you can have all the solutions available that you want, public and private, but if people don't feel comfortable admitting that there's a problem or someone in their family might be struggling with addiction, then they're not going to get that help.
Sure, absolutely. And that's why, and it's so important, as you're saying, to get to the actual root of the problem. Obviously, having solutions for kids who need a place to stay, ideally, they don't need a place to stay because their parents aren't having issues. And absolutely, one of the things that was so great about this, and if you go to my piece in Opportunity Lives, there's a link to this video of some of these grandparents speaking, and you can see that these are families from all different backgrounds, race, ethnicity, economic status. This isn't something that affects one kind of person, one kind of family. It's not men or women. It's everybody. Anyone can be touched by addiction. And this is, like you said, that's an important thing to talk about and be open about. And some of the grandparents talked about that too, that some of them have sort of self-isolated because they feel some kind of shame, saying my child was unable to take care of their child, and so now I have grandkids. They don't want the stigma of being a parent that raised an addicted person. And so I think that we absolutely do need to continue having those conversations, that this is something that can happen to anyone, and we need to be able to step in earlier and have people feel freer to say early, I need some help, so that it doesn't get to this point.
Yeah, and I mean, it's tragic any way you put it. And you look at these grandparents that are stepping in to now raise their grandchildren at a time when they didn't think that they would need to have the energy,
Sure.
the resources, the time to do that. And as much as I think there's an education that needs to come, for the grandparents that find themselves in that position, also, what about the children themselves? What can be done specifically to address their needs moving forward in life?
Well, again, there were a lot of talk of things like support groups, and letting the children know that they are loved, they are cared for, none of this is their fault, and that they are a joy to their grandparents. This is a really difficult situation, but it is not a burden for their grandparents to care for them. They're in no way to blame, even though they probably had some really rough things happen. The grandparents frequently, a lot of these children are born addicted or born with a lot of medical issues because their parents were using while they were pregnant. And so these grandparents are also navigating a special needs system or a special education system. So it's just about loving these children from, the family, the community, and just showing them that everyone is there for them. People are on their side. This isn't a blame situation.
All right. Well, Amelia, thank you so much for joining us to talk
Thank
about
you.
this incredibly important topic in the country right now.
Yeah, so wonderful. Thank you for doing this. Thank you for using, Opportunity Lives to really shed light on this issue, and we're thankful for you. So